We're now hearing from the New York Nurses Association tonight, responding to some strong words from the Albany Med CEO.
The hospital CEO, Dennis McKenna, scolded the union for not taking its contract offer, and more than a dozen nurses provided by the hospital also expressed disappointment in how the union is handling all this.
Tonight, the response from the union on that. News Channel 13's Tessa Bentulin joins us live right outside Albany Med as she continues to cover this story. Tessa, good evening once again.
Hi, good evening, Sabrina and Mark. Today I spoke with Tanya Basil over Zoom. She's not only an Albany Med nurse, but she is also at those very bargaining meetings with the union and the hospital. She says the hospital continues to deny the staffing crisis. Now, I do have the current number of full-time nurses at Albany Med. That is 1,683. The hospital says that is full staff, but Basil says that's not enough. She knows many nurses, she says herself, that are burnt out and overworked. Now, this current contract proposed by Albany Med would include more recruitment and retention efforts for staffing and a wage increase from the current $33 an hour to $37.50 an hour immediately, and that is a base increase. The nurses union also weighing in tonight as a whole. They sent a statement saying they will not be silent and will not be bought off and continue to bargain in good faith. Now, I also spoke with 13 nurses who work at Albany Med, and all of them tell me they are for this latest contract. Those nurses were provided to us by Albany Med, and those nurses say there is a lack of communication from the nurses union. I asked Basil about that.
The nurses have told me that they do send emails to the union, especially of recent with this new contract, but they don't hear anything back. Why is that?
Again, we're not allowed to communicate. If we do these things, we get fired. So I've been written up twice already, and I can be fired if I get written up again because they've heard that I am communicating with our own staff.
Why not let this go to a vote? If you believe as a nurses union that this contract is not fit for nurses, why not let the nurses decide and make a no vote?
Well, if they had all their information, and a lot of them still do. I mean, you spoke with 13 nurses that don't, and what we are fighting for is for safe staffing ratios and for safe care to our patients. That the hospital is not putting on the table. They think we are about money, the dollar signs. Yes, everybody needs to have a living wage, but we need to have a wage that will retain the staff.
Now, you heard me discuss it there with Basil just a little bit, but if this said contract were to be accepted by the union, then it needs to go to a vote. But only the people that are voting are nurses who pay dues to the union. So I asked the union directly, what is that number? But they would not give me a direct answer. And Albany Med says they are not told which nurses are part of the union and which ones are not. Reporting live here outside Albany Med, I'm Tessa Bentulin for News Channel 13. Mark and Sabrina.
Tessa Bentulin continuing to cover this. Thank you very much.